Welcome back our fans to TMD. Temporomandibular disorders. Temporomandibular joint and muscle disorders, commonly called TMD, are a group of conditions that cause pain and dysfunction in the jaw joint and the muscles that control jaw movement. 1. Myofascial pain involves discomfort or pain in the muscles that control jaw function. 2. Internal derangement of the joint involves a displaced disc, dislocated jaw, or injury to the condyle. 3. Arthritis refers to a group degenerative / 4. Inflammatory joint disorders that can affect the 5. Temporomandibular joint. Myofascial pain dysfunction syndrome. Definition: it is not a disease entity rather than set of etiologic related disorders. It is functional disorder characterized by discomfort in the oral and peroral region induced by movement of the jaw, and independent of local disease involving teeth or mouth. The MPD usually in the form of combination of facial pain and mandibular dysfunction. Myofascial pain dysfunction syndrome. MPD. Signs and symptoms. 1. Pain. It is most often unilateral, dull ache. The locations of pain may range from the back of the head and neck posteriorly to the temporal area superiorly and to the angle of the mandible. Inferiorly worse in the morning. 2. Tenderness on masticatory muscles. Muscles which are primarily involved in MPD are the muscles of mastication. Muscles secondary affected are sternocleidomastoid and trapezius muscles. 3. Limitation in mandibular movements, during closing, opening and lateral excursion. 4. Absence of clinical or radiological findings in the TMJ. 5. Lack of tenderness in the TMJ when the area is palpated. Diagnosis. Clinical examination. A. History. B. Determine range of mouth opening. C. Direction and degree of deviation of the mandible. D. Examination of occlusion. Deflection in opening caused by 1. An intracapsular problem, disc dislocation without reduction. Deflection to the ipsilateral side during late stages of opening. 2. Unilateral elevator muscle spasm, such as masseter becomes shortened. Differentiation. Protrusive and lateral. Eccentric movements. If the problem is intracapsular, mandible will move to the side of involved joint during protrusion and be restricted during contralateral movement, e. Normal movement to the ipsilateral. If the problem is extracapsular, there will be no deflection during the protrusive movement and no restriction in lateral movements. Joint sounds. There are 2 types of joint sound to look out for. Clicks. Single explosive noise of short duration. Crepitus. Continuous grating noise. Clicks. Left, right or bilateral. Painful or painless, consistent or intermittent. The timing of a click. A click heard later in the opening cycle may represent a greater degree of disc displacement. Clicks may frequently be felt as well as heard, though they are not normally painful. If the click is relatively loud, it is referred to as a pop. Crepitus. Crepitus is the continuous noise during movement of the joint, caused by the articulatory surfaces of the joint being worn. This occurs most commonly in patients with degenerative joint disease. Trigger points. Hard, palpable, discrete, localized nodules, called trigger points, TRPS, which are located within taut bands of skeletal muscle. Treatment. Objectives of treatment of MPD dysfunction are 1. Control of pain and discomfort. 2. Elimination of occlusal disharmony. 3. Lowering of psychological stress of tension. Treatment. 1. Patient education. 2. Medication, Analgesics, muscle relaxants. Antidepressants. 3. Physical therapy, range of motion exercise. Heat therapy, massage, ultrasound. Transcutaneous electric nerve stimulation. 4. Injection therapy, local anesthesia, Botox. 5. Splint therapy. Thanks for watching. Support us by likes and subscribes.